Sometimes small goals lead to profound effects. Hello, this is Dr. Siddharth Dambar, physician here at Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. It's interesting, how do we as physicians, when it comes to the conditions that we treat, how do we assess improvement, especially when you're talking about chronic conditions, let's say someone who's got an autoimmune issue or chronic arthritis, as opposed to someone who comes in with, let's say, an infection or a broken bone. An infection or a broken bone, your results are either that issue got fixed or it didn't. Did they recover from the infection or they didn't? But for chronic issues, how do you gauge how well somebody is doing? And it's an interesting thing because a lot of times we utilize measures and metrics that are meant to track what we think are objective issues, but don't always really get to the essence of what a person may be dealing with. So for example, if you have arthritis in a knee, we're tracking, look, how does your pain feel? How are you able to do in terms of functioning with exercise, at rest, with normal activities? That gives a sense for how well you're doing. And yet it still misses a bit sometimes objectives and measures that really matter to the person who's living with that condition. And so I have an example of where a simple or small goal really led to profound effects for this individual. So a patient of mine who I've seen for a number of years has very significant inflammatory arthritis from their Sjogren's syndrome as well as osteoarthritis. She's in her 80s. She used to be a baker, so her hands have had a lot of collective damage over time. And she mentioned several years ago that she was losing the ability to do knitting, which is something very important to her. And so I'd mentioned at that time, well, our goal should be, can we keep you knitting? And I hadn't really discussed that with her for a few years, except more tracking how is she doing pain-wise, with her condition in terms of inflammation, and general function-wise. And so today she mentioned that right now her condition was really well controlled, and or at least reasonably controlled. She's not flaring, and her hands are generally feeling pretty well. And she mentioned that she's still able to knit. Now, on the surface, that sounds like, okay, good. She maintains her activities of daily living. She can still use her hands for some fine motor activities. Great, she's doing well. But it came up because she mentioned that one of her granddaughters has her bat mitzvah coming up in another year. And one of the things that she wanted to do for her was to knit a sort of shawl that she would wear during her ceremony. And that was an incredibly meaningful outcome for her. And it's the kind of thing that is very hard to really track in terms of some of our disease activity measurements, but is clearly a very significant outcome for her. And in this case, a seemingly small goal or small result has a really profound effect, that she's able to do something for her granddaughter that is very meaningful to her. And it's a reminder to me that while we try to track outcomes objectively based on how patients are feeling, how does their exam look, how do their labs and imaging look, and all that kind of stuff, sometimes just slowing down and realizing what is really truly important to that individual can go a long way to figuring out whether or not you're hitting their goals as well.